Hi everyone. Today I'm going to present Safety, Health and Environment Management EMSH 5103. My name is Tommy Binyo. Matriculation number CGS 01996819. Let's go to the introduction first. I want to present about my workplace. Its location is at Bakun Hydroelectric. The project started in 2002 and completed in 2010. The owner of the project is Sarawak Hydro's Berhad and is now in the operation and producing electricity to the state of Sarawak. Since its completion, Bakun Power Plant now produces a large of providing electricity to serve the users of state of Sarawak. The core business in our company is to provide a service of utility throughout Sarawak. Our mission is to provide a green power or clean energy towards safe and environmentally friendly services. In core of utility service provided, we will ensure the light is always available for people and power should be always available for business and development requirement. Excellent power service provider requires a great organization. Next. This is our safety, health and environment organization chart. As you look there, we got our vice president, our safety, health and environment manager, and then the safety, health and environmental officer, and the staff all play a specific role and their responsibilities. Next slide. Now I want to explain about COVID-19. COVID-19 is a virus spreading, a virus caused respiratory disease. Since it was discovered, the virus has rapidly spread to the other countries' world, including our country, Malaysia. The pandemic is much more than a health crisis. It's also an unprecedented socio-economic crisis. As an article published by UNDP mentioned that every day people are losing job and income with no way of knowing when normality will return. Small island nation heavily dependent on tourism have an empty hotel, deserted beaches. The International Labour Organization estimate that an 195 million jobs could be lost. The virus was diagnosed as a viral pneumonia, which can transmit from human to human or via contaminant transmitting. The virus is spread primarily via nose and secretion, including small droplets produced by coughing, sneezing, and talking. Most people infected with COVID-19 virus will experience mild to moderate respiratory illness and recover with a doctor treatment, but there is no guarantee for a long time recover due to no proven vaccines discovered yet. As we know, while COVID-19 is still on, these are recommended preventive measures can be taken against virus spreading. Wear 3 ply of face mask properly and fully cover nose, mouth, chin, wet public area, and communicating face to face. Practice social distance and comply standard procedure recommended by Minister of Health and World Health Organization. Frequent washing hands with soap and hand sanitizer. Comply to all regulation proposed by the government to ensure we can break the chain of COVID-19. Let's move to risk hierarchy report, risk identification. Hazard at the workplace can be classified as a source or situation which are potential for harm in terms of humanity, injury or ill health, damage to property, damage to the environment, or combination of these. COVID-19 can be classified under biological hazard. Biological hazard are organic substance or viruses that pose a threat to the health of human. Unprotected export to this biological hazard can result of disease transmitting in range of infection and illness. Indoor workplace, like an office, confined space areas such as meeting room, pantry, where employees generally work in enclosed area with a central air conditioning, are the potential exposed to this virus spreading. Hazard identification. Classified as an undesired event that lead to the materialization of the hazard and mechanism by which the undesired event could occur. In scientific, COVID-19 categories under developing hazard because this virus cannot be recognized immediately and it will develop over the time. Risk assessment. Risk assessment clarified as the process of evaluating the risk of safety and health arising from hazard at work or workplace. It serves to identify and assess the risk derived from the hazard and finally lead to appropriate action to reduce, mitigate, or even eliminate such risk. For an example, assessing the risk of COVID-19 exposure at the workplace by assessing to the risk probability. If the uncertainty dimension of risk is to be properly assessed and described using the term probability, it is essential that assessors understand on what they are trying to assess. Relative risk assessment can be calculated using relative likelihood and severity. As we know, we will get the risk of high, medium, and low. And the risk control. Risk control is classified as a method of use to reduce the amount of inherent risk or to manage a risk. In risk management, risk control involves dealing with the hazard. There will be a situation where the combination of control measures will need to be used to control hazard and risk. Controls are usually placed and source of hazards come from or along the path where the hazard comes, such as the gas and the workers. A priority order of control measure ranging from elimination of hazard and associated risk to providing people with protective equipment such as for COVID-19. Provide staff with a face mask, hand sanitizer, and other protective equipment for preventive measure. Obviously, it is better to eliminate the hazard if possible. Another concept of risk control measure is depending on the type of risk control requirement. This includes preventive, corrective, defective, directive control measures. Overall, this process, we do apply PDCA or plan, do, check, and act. For conclusion, it is essential of implementing hierarchy in a workplace to avoid any harm to the organization. In conclusion, coronavirus usually can cause a mild upper respiratory disease. It is possible that COVID-19 will continue circulate in human population because specific antiviral treatment and vaccine are still under development and testing. Quarantine, practicing standard of procedure recommended by Minister of Health and practicing social distancing are encouraged to prevent virus spread. Hazard at the workplace can be identified, access control by practicing a hierarchy. Implementation of hierarchy in the workplace is essential to avoid any harmful to our organization. Practicing a new norm in the workplace and new culture must be integrated into the organization with an effective safety and health policy for the prevention of coronavirus spreading. And together we fight against coronavirus spreading. That's all. Thank you.